Thank you, Mr. Chairman, and thank you for this hearing today. As you and I have discussed, workforce within healthcare is something that is critically important. We both come from rural states, and when I think about the challenges that we face in providing health care in a big state geographically with small population, and the many challenges that we face, we can overcome a lot of that, but if we don't have the trained workforce, it just doesn't come together. So don't take my lack of chair time here as an indicator that I am not interested in addressing the challenges that we face in this. We've got competing hearings this morning, and so I've been jumping in between. But one of the ways that we have been trying to facilitate better access to care in a remote place like Alaska, where 80% of our communities are not connected by a road, is telehealth. We're working on the broadband to connect everybody so that telehealth actually is more than just the device, but it actually works. And I know that this subject has been raised, but I'd ask you, Dr. Swaney, apparently you had mentioned a pilot program for virtual nursing education. So in other words, this is a big challenge for us in Alaska. We got a nursing program, but how you get the teachers to teach it, can more be done with the nursing education programs for telehealth as opposed to just how we're thinking about telehealth generally?
Yeah, thank you for that question, Senator Murkowski. Look, telehealth is a critical component for how do we reach our rural communities and address some of this, including on mental health, where there are many good models. And with the pandemic, we saw about a 400% or 500% increase in telehealth use during the pandemic, and we're able to demonstrate effective care for many patients using telehealth. So I think we've learned a lot from the pandemic. On the nursing side, our virtual nursing program really is not an education program, although there is some learnings for the bedside nurse, as it is a patient-facing program. And so there's a bunker where we 24-hour monitor the patients, and that allows the nurse then to be at the clinics, at the bedside, caring for the patient. And all of that electronic health medical records and a lot of that administrative work can be done by the nurses in the bunker. And for instance, a good example would be upon discharge, which could be an arduous process of all the paperwork to discharge. The bunker can do a lot of the administrative and all the discharge work, while the bedside nurse can just do the clinical work, and we can quickly facilitate transitions from a patient from the hospital to their home. So we haven't done a lot on the telehealth education on the nursing side other than that program. And like I said, the education component is that bunker also can work with the bedside nurse as an education part.
Let me ask a little bit different question, and again, it speaks to some of the ways that we are addressing healthcare challenges in Alaska. We rely a lot on EMTs. I was just visiting with a woman from Chicken, Alaska. Chicken has probably never been a population of more than 100 people. Probably won't be, but her son is an EMT there, and basically what they do is they work to make sure that anybody out there can be trained in emergency services. But I understand that right now we have a significant shortage of EMS professionals. Studies have found that less than 20% of EMS organizations, at least in Alaska, have an adequate level of staff across the nation. Turnover of EMS professionals hovers near 30%. Very few stay in their role long enough to establish the stability that they need. What more do we need to do in this area? We've been talking about everything else, but what about emergency medical services? Dr. Herbert, you're nodding. I don't know who to direct this to, so I'll just throw it out there.
Thank you. Well, I was just agreeing with you. I tend to nod. I'm not a good
I'm a
poker
nodder, too.
player,
That's okay.
but I will. First of all, I completely agree with you about EMS, and so there are many of us. I'm sure my colleagues on the panel are responding by strengthening our programs in that regard, and we have a robust program at my university. But if I could speak briefly about the telehealth piece, because I completely agree with you, we face the same challenges in Maine. The last time you and I talked was in Reykjavik, and there are people in Iceland and in Scandinavia that are really leading the world in terms of telehealth developments. And so we have a lot to learn from those folks. And telehealth is exploding in terms of beyond just telehealth, digital medicine, being able to monitor chronic conditions remotely and feed that information back in real time to providers. And then in terms of rural settings, people think of telehealth being from the provider to the patient, but it's also the provider back to the tertiary care medical center to get the consultation that they need. Tremendous work going on in this. What I would simply add is that we need to make sure that our regulations, the state-level regulations, licensing boards, accrediting bodies, government reimbursement, that it keeps up. So we saw some positive changes during the pandemic. We need to make sure that those are sustained. But my concern is that with the incredible innovation that's going on, and this really is going to be transformative over the next 10 years, that these entities are going to fall behind, and it creates tension and delays the full utilization of telehealth and digital medicine.
Thank you. I'm well over my time, so thank you all, and we'll probably be following up on some of the telehealth conversations. Thank you so much.
Thank you, Senator.